This program is a paid commercial announcement and in no way represents the views of WPH.D or its management.
Talk Radio 1210 WPH.D, WPH.D HD, WOGL HD3 Philadelphia. Now, Health Watch, featuring Dr. Molly Fantasia, the PhD doctor and founder of Innovative Medical Associates, with valuable information that could help you improve your quality of life. Now, Health Watch, and your host, John Damazzi.
Good morning and welcome to the show. It is our weekly edition of Health Watch, and we are here every Sunday, as the man said, from 8 till 9 here on Talk Radio 1210 WPH.D. What do we do here on Health Watch? Well, the clue, as we always say, is in the title. We talk about your health, specifically with Dr. Molly Fantasia, the PhD doctor, executive director, and founder of Innovative Medical Associates, Marlton, New Jersey. And we talk about the who, what, when, where, why, and how of Innovative Medical Associates.
John.
I mean, we cover it all, right?
We try.
Okay?
We try, John.
Listen, we have an hour, and we could probably go 3 hours to cover it all. But that's another story. But if you have a question during the course of the show or a medical challenge, we always invite you to call in at 855-839-1210, 855-839-1210. Again, it's Health Watch every Sunday, 8 till 9 here on Talk Radio 1210 WPHT. A lot of amazing stories, Dr. Molly, and we're going to get into a couple of them a little bit later on in the show. But over the course of 20-some years, 26 years, over the course of 26 years, you've had a lot of really good success stories.
I would say, here's the thing, John. How do we measure success? We measure success in the fact that we can improve people's quality of life and keep their quality of life well into their 80s or 90s. And we want it. That's really what we set out to do, and that's what we do. I don't like to use the term anti-aging or longevity. I think quality of life really does fit our facility. We really are a facility of like-minded practitioners who really want to help people with whatever type of medical condition they have. But we don't want to do that all the time the way most primary care people do.
You always talk about quality of life, and I think sometimes people have a little bit of a difficulty understanding that.
Well, sure.
So talk about what you mean by quality of life.
Well, when I mean about quality of life, I want to know what's important to our patients. In other words, for some of our patients who are in their 80s who really like to spend time with their grandchildren when they have a debilitating condition like cancer and they take the chemo and they do all this, many days they just don't feel like doing something with these kids. Well, bottom line is we want somebody to be able to do that while going through traditional and or non-traditional treatment for their condition, because it's always codependent on what the patient wants and what does the patient think is important to him or her.
And obviously spending time with grandchildren is important.
Right.
And you want to be able to do that. But a lot of times people come to you, they can't even get out of bed.
Exactly.
So
in that case. Also, how about in the case of younger people? I have athletes who come in to see us. So they said they have a sports injury or whatever, and they're not really enjoying their physical therapy that they're doing to, repair this. How can I give them a little more stamina to do that? Well, we can. We can and do.
And you do that through hydration.
Exactly.
And explain what that does and how you do it.
Well, I just read an interesting article. What we do is we use natural substances. So, again, it'd be like the kind of thing you find in health food stores. Vitamins, minerals, amino acids, maybe some homeopathics. Those kinds of things you find in your health food store. The real conditions that we treat are a myriad of them. But the most important thing is we know that by delivering through hydration, we're able to get someone to a therapeutic level of those natural substances and thereby maybe cut down on some of their pharmaceutical drugs and also then improve their quality of life. Pretty simple.
And we should also mention the hydration, but in the hydration bags, this is where your expertise and your background comes into play. These are protocols developed by you,
sure,
and exclusively for
our facility.
For your facility.
But
right.
What's interesting is, there's a lot. Everyone knows there's a bunch of spas that have opened up, and they're doing vitamin C, and they give them fancy names like Restore or Immune, whatever. But the point is, what we do is usually very specific to the patient as well as the condition. And why do I say to the patient and the condition? Because there are so many things that enter into this. For example, a patient may, based on some things I see, may not be able to take a drip in an hour. They may need an hour and a half.
Right.
So it isn't one size fits all. It's really unique to our patient population.
I happen to be in a shopping center the other day, and they had one of these spas in there.
Yeah.
And they had two big signs out front. Suffering from a hangover,
we can
help.
That's the big deal. Yeah.
We can help.
Yeah, that's the biggie. That's the
right.
big one. But, here's we can help too. But,
yeah, I know you can.
But the point is, I really don't want to focus on this. We are a medical facility with a medical type of protocols that actually can help patients in various ways and continue their quality of life through some severe types of conditions, John.
And we've often talked about this, and we will later on in the show. Patients with cancer, your cancer support protocols.
Yes, of course.
Diabetes,
right,
heart.
Of course. You name it.
Autoimmune. I mean, that's
autoimmune
plenty of
is
those.
huge,
Right.
huge. And yes, of course, we can help you with your hangover, but I think we want to do a little more than that.
When you start your hydration therapies, when a patient starts, and we're going to talk about a couple of new patients,
right?
What can they expect? I mean,
they can expect
once a week, twice a week.
Well, it depends on the condition. It depends on how far they are in the continuum of their traditional treatment, if at all. It can depend on what I see back after the first treatment, see how well they took whatever we gave them, and also look at their blood work when they come back in for the second treatment. And we then make a decision with the patient, whether it's once a week or twice a week. And generally, it can last anywhere from 5 weeks to 15, 20 weeks. And some people with cancer, they tend to come in after their conventional treatment, and that may go on for a year or so.
I was just going to ask you, because I've been coming 20 years.
Well, you have several conditions,
that's true.
John.
But there are people who have been coming as long,
Yes.
and some have been coming 10 years or whatever.
Right.
So can you talk about that, why that is, or
well,
what's the story
lots
there?
of that comes with people like you, John. There may be in their 60s or 70s, they're self-employed.
You're being kind.
They're in their 60s or 70s, and maybe even in their 50s. They have some high-profile jobs. They're entrepreneurial. They think out of the box, and they want to always stay at the top of their game. And so I have patients like that who we've helped them through some conditions. They feel better. They want to maintain that feeling of health, and we want to help them do it.
You've often talked about pharmaceuticals and your philosophy, the least amount necessary. Let's talk about what you do as far as the hydration protocols. Are there side effects for those?
Well, you can always get side effects from anything. But I will tell you, in 26 years, our side effects have been absolutely negligible. I mean, if you take all the patients we've done, I guess the one thing we've seen is that people don't eat before they come in so they can have a little imbalance in the blood sugar. And what do, John? We have crackers and things.
That kind of, right.
We have dried fruit, things like that to help them get through it.
Okay, we're coming up on our first break of the morning. Our program is called Health Watch. And you'll find us here every Sunday, 8 till 9, here on Talk Radio 1210, WPHT. Dr. Molly Fantasia is here, the PhD doctor, executive director, and founder of Innovative Medical Associates, Marlton, New Jersey. You have a question for Dr. Molly, a medical challenge, 855-839-1210, 855-839-1210. That's the number here in the studio. And we always tell you at this point of the show, call early, because then Dr. Molly has plenty of time to talk to you and really go over your situation. And invariably, and it happened again last week, we have people calling at 8:58, which is a little hard to talk to you for a minute and a half. 855-839-1210 is the number with Dr. Molly Fantasia. I'm your host, John DeMasi. More Health Watch after these words. And we're back here on Health Watch. Operators standing by right now at Innovative Medical Associates. And we give out this number because a lot of times people say, gee, I want to get some information now, and I want to make an appointment to sit down with Dr. Molly. The initial consultation is complimentary. You can do that right now by calling them at 856-489-0505. Again, 856-489-0505. You can call now. You can call after we leave you at 9 o'clock, or you can call anytime during the week, 856-489-0505. Innovative Medical Associates, Marlton, New Jersey. And the website, innovativemedicalassociates.com. Innovativemedicalassociates.com is the website. And our show is Health Watch, Sundays 8 till 9, Talk Radio 1210, WPHT. Again, our number here in the studio, if you have a question for Dr. Molly, 855-839-1210. We had a caller last week who was
he was great.
He was a big hit, right?
He was a big hit in our facility, wasn't he, John?
Yeah, he
People
was.
were talking about it. And, of course, it's about our wonderful COVID positions in this world. But he was just so funny, John.
He was. And
he was great.
People thought that we knew him. Or we
didn't know him, but he's a very nice guy. Whoever he is, he's a smart guy.
Yes.
So brings me to what I want to talk about.
You want to talk about this post-COVID
Yes.
and one of your patients,
Yep.
Tim.
Yes.
And what's the situation? Give us the background.
Well, the background is, of course, we sent him to the hospital. The minute we saw, we actually were, we were open through COVID, as you know.
Right.
And the minute he came in, I could tell he was a little under the weather, but we tried to do things a little judiciously. He was checked out, and immediately we sent him for a chest x-ray. And thank goodness we did, because he had the COVID pattern. So he was pretty bad. Got into the hospital. He ended up getting the remedies there, etc. Came back to me after the hospitalization, and by the way, they kept telling him he's a miracle, but I think he is a miracle, and I think that God had a lot to do with it, and also allowing us to deliver to him some of the IV treatments that we use for the COVID protocol. But the interesting thing is, he now has been discharged off of his oxygen, even his smaller unit that he was walking around with. So he's completely off of external oxygen, which is a big deal. One of the things we did for him post-COVID was the use of progenitor cells. And these cells have the ability to go through the first pass of the lungs. So I was fairly confident, and I had a discussion with my docs about it. I was fairly confident that if we look at the right type of progenitor cell, which we did, we might be able to have that first pass and have the progenitor cells go in and remodel the lung. Well, it seems to be working. And he's doing so well. He's able to walk a few blocks now he's off of the oxygen completely. But one of the things he's very set on doing is he wants to get back to his exercise regime. And of course, between the doctor of physical therapy and Dr. Pat, we're saying not yet. We're making him do a little physical therapy at the office to get back, because after the exercise, his oxygen drops a little bit, and we want to make sure that he's fit to go back to doing the exercise. And by the way, you know how you guys are. You're not going to do little exercise. You're going to be doing bench presses. No, we want him to take it easy, because his recovery has been very, very interesting.
And this was done with progenitor cells?
Was done with progenitor cells plus our post-COVID protocols.
Your hydration protocols?
Yes.
All right.
Yes.
Is this like 21st century medicine?
I believe it is. I believe it's almost 22nd century medicine. I think the way you use this and the novel ways that we're able to do this, I think is going to make a huge difference. Talk about anti-aging. Progenitor cells are young cells. They're the cells that have no specific when given, they have no specific job. They can go where they're needed, and that's the beauty of them. So if you have a problem with your immune system, we expect that it's going to help your white blood cells. If you have a problem like he did in his lungs, we expected that the lung would improve. So it really depends.
It's a good thing that he ran into you. I mean, that he met
Well,
you.
no, he's been our patient
Right.
for a long time.
But
Yes.
I'm saying, had he not done this? Or
Oh, no. Well, yeah, it was a wonderful thing. And this is what I mean by what we do. We're not worrying about your hangover, right? When he came into us, we still had to look at him in the medical model, right? And it was because of that we sent him out to the hospital, and to the hospital we knew was delivering some of the novel approaches to the COVID, and it was the right decision.
Moving forward, he won't need the oxygen like you said.
No, he's doing really well. He hasn't. He didn't even need it after we put him on a particular instrument we have in the physical therapy room, and he did pretty well. He was able to recapture his own breath, and that's what we want. So he's doing really well, John.
855-839-1210 is our number here in the studio. And again, if you have a question for Dr. Molly or a medical challenge, certainly you can call in. Feel free to call in at 855-839-1210.
And, John, in the same vein, I want to talk about these long haulers. That's something we're seeing more and more of. And again, we have a protocol for this. It is amazing. People don't realize how long they will suffer with this post-COVID situation. You think, okay, I'm out of the woods. Yeah, but you have a whole lot of dysregulation going on in there. And that virus did a job on people.
I know my godson had COVID a year and a half ago. He still can't smell.
Yeah, that's one of the things.
Telling me that. Yeah.
Interestingly enough, I have a protocol for that. He should talk to me.
Okay,
I know he doesn't live here.
He doesn't live here,
right?
yeah.
But I think I might be able to help him. Okay.
All right, 855-839-1210. We're talking about a success story and a really nice story about a patient, but you have many other success stories.
I do.
And I wanted to talk about your Dr. Pat.
She's one.
You walked through the clinic with her the
I did
other
that
day.
on purpose.
I know you did. And I was like, is that you, Dr. Pat? Yeah, I can't believe it. And I said, well, we talked about you last week, but I had to talk about it this week because I saw her, and I was like, you didn't think it was the same person.
It was absolutely not the same person.
I mean, what can you briefly give us the story of what happened?
Well, Dr. Pat suffers from MS, and she'll tell anybody who comes in, and she's there, and when she's working, she's there, and she's also a patient. Which is how she became part of our medical team, because she not only believes in this type of medicine, she used this type of medicine for herself. So, she came in to see us, and I've been fooling around with these progenitor cells, and I convinced her to try them. And she said, well, the data's mixed, and I like that. She said, but you know what, Molly? When you have nothing to lose, why wouldn't you try this? Well, she came in, and, I've been following her very closely, and we've been collaborating because we're going to write the case up.
Yes.
She says, look at me. I said, I am looking at you. She said, everybody in her family is telling her they can't believe it. She's walking the beach every day. So she said, Molly, I can walk the beach. I said, I see it. So when she came in this week, now mind you, she comes in once a week for her treatments, as well as working in the facility and seeing patients for me and collaborating on some things. She was an anesthesiologist, by the way. She had to retire from anesthesia because of the MS.
Right.
So when she got to me, she knew she needed to do something because things were getting progressively worse. So bottom line is she had 2 full treatments of the progenitor cells. And, of course, we follow it up with, what do I talk about? Feeding those progenitor cells. She hardly ever misses a week from her hydration, ever. And in that, I've given her many of the things we need to solidify the progenitor cells. Well, this past week, she was like a brand new person.
So it's a result of the cells
and
the
hydration.
Okay.
And she'll tell you that herself. She has no axe to grind. And she goes to a very big system. She goes to the best in the area for a neurologist, all of this. She does physical therapy as well, which you should do because you have to keep that muscle memory. She does all of that, but she said, Molly, come here, look at my improvement. She brought in the stats from the physical therapy. It's like a different person.
And this, of course, is a great success story. And what can you tell people who may be suffering from similar conditions. I mean,
Well,
what can you tell them?
neurodegenerative diseases, I say, what do you have to lose? First of all, one of the things I want to say is everyone out there knows there are all these regenerative medicine clinics. There are all of them all over, right? And they go, oh, my God, but Dr. Molly, the prices are like out of this world, this and that. And I understand it takes a lot. You have to worry about insurance. You have to do everything that you have to do.
Yes.
But the point is, we've tried to make this accessible to people, and I think I've done a good job in that. And still do a great job. So it's here. They can use it. You have to stop being myopic that if this is the only thing out there, do you want to give up? I doubt it. And you certainly don't want to give up at the age Dr. Pat is. Right? She's in her 60s.
Yeah, she's young. Yes.
She's young.
Absolutely.
And the thing is about these progenitor cells, the earlier you get in, the better you are. But it doesn't mean that we can't help you somewhat improve your quality of life no matter what stages you are.
All right, we are at the halfway point of the show, which means you still have plenty of time to call in, and I suggest you do that now before next thing you know, you look up at the clock and it's time for us to go. So you got time. Give us a call, 855-839-1210. That's the number here, 855-839-1210. You have a question for Dr. Molly, or perhaps you have a medical challenge you want to run by her. Maybe you're kind of at the end of your rope and you don't know what to do. Well, this is a good time to call in, 855-839-1210. The show is Health Watch, Sundays 8 till 9, Talk Radio 1210, WPHT. Dr. Molly Fantasia is here, the PhD doctor, the executive director and founder of Innovative Medical Associates, Marlton, New Jersey. And I'm your host, John DeMasi. We're coming back, more Health Watch after these words. Back here on Health Watch, here's the number. Operator standing by right now at Innovative Medical Associates, 856-489-0505, 856-489-0505. That's the number for Innovative Medical Associates, Marlton, New Jersey. You call right now. Really, the best thing you can do is make an appointment. The initial consultation with Dr. Molly is complimentary, and that's where you really can get a lot of your questions answered and kind of figure out all the information you need, whether you want to move forward or not. 856-489-0505. And remember, you can always check out more information on the web, innovativemedicalassociates.com. innovativemedicalassociates.com is the website. And again, our show is Health Watch, and you'll find us here Sundays, the live version, 8 till 9 on Talk Radio 1210, WPHT. Our number here in the studio, 855-839-1210. You have a question or a medical challenge you want to run by Dr. Molly, 855-839-1210. We're going to talk about, you have a lot of new patients. And this particular new patient, this is a tough case, but you've had many tough cases.
Sure.
Stage 4 ovarian cancer. So
right.
what can be done about this?
This is a very interesting case because she had the surgery and she's doing pretty well. She really didn't like her options after the surgery, which was they told her it was an extremely aggressive ovarian cancer. So she wrapped up some of her reports and brought them in to us, and we sat down and we had a team conference. I met with her first and pulled it all together, and then I had a team conference with the docs. And the thing about this case that bothered me is they did a study on the pathology called Caris Labs. It's something we use because my consulting oncologist loves that. And what that particular study does, it shows what chemotherapeutics would have the best effect on her particular cancer. Now, there are many companies that do this, and most hospitals and most pathology labs don't use that particular test. It's something we used a lot because, again, my consulting oncologist brought it to our attention and said, this would be the test he would want to see if I want to consult with him on a case. But the thing that bothered me was they never brought it out to her. They didn't send it over to the, this is in the traditional place. They never sent it up to the doctor who would be doing the chemotherapy. They never sent it up to the doctor who would be doing the radiation if she chose to go those ways. In other words, they never put that in her packet. And when she came to me, I said, that's yours, get it. because we're going to need it to send it to our consulting oncologist.
Right.
Because there may be a better chemotherapy than just the standard chemotherapy they give everybody. So the point of that case is she's starting with me on Monday. We have a protocol that we're going to use for her in the interim. You know, I'm putting her whole file together, get an adjunct opinion from our oncologist. And in between that, I told her, go for your second opinion, which she's done, and get that second opinion doc a copy of that particular report as well. So in this case, we acted also as an advocate as well as helping her through her particular choices. So it's an interesting case, John.
Let's talk about your cancer support in general. And obviously this is a patient who's in that. What does it do, and how does it help
What
patients?
we like to do is we like to help people. Let's say you've chosen to go through a course of chemotherapy. Well, we will help you. We want you to maintain a certain amount of stamina through that so that at the end of the chemotherapy, you're not washed out from the chemo and not the cancer, right? There's really where we come in. Also, you know, there's a lot of data to support the use of vitamin C. Now, you will hear oncologists tell you, no, you can't do it. Vitamin C is an antioxidant. We're creating free radicals, which is right. And we don't want that. We don't want that. Right. You may not want that, but C also has a pro-oxidant effect, which means it can help and intensify the chemotherapy, assuming we do it in the right and appropriate way. And we don't just use vitamin C in our cancer supportive therapies. We generally use some other things, homeopathic, some peptides. We use many things for patients depending on where they are in their continuum and what we want to accomplish. So the object of the cancer supportive therapy is just that. We want to support the patient no matter which way they decide to go, and we want to help them through their conventional treatment without having them washed out, tired, fatigued, half dead by the end of the treatment, not from the cancer, but from the chemo, treatment. So there is the thing. We also want to help them with their diet, which we do. We want to support them with more natural substances that they may have to take at home as well. So there are many facets to it. It's not one size fits all, and it's not one course of treatment for the particular cancer. I think in this case, we helped this particular new patient in that we told her several things that she was unaware of. One, that particular situation that was sent out from her pathology to tell them what chemotherapies might work gives her a whole lot more data than just going to the oncologist who says, well, this is what we do for this cancer, right? We're looking more specifically for her. I think that information is going to behoove her well.
As you've often said, with you, one size doesn't fit all.
One size doesn't fit all, and that's true for conventional treatment too. Many times people fit within the conventional model, but there are many times they don't. And the other thing I like about this particular test is it tells all of the studies that are going on all over the country. So just because you didn't qualify for a study here in this region doesn't mean you won't qualify for one somewhere else. And wouldn't you like to know what's going on?
Absolutely.
So,
and also, you mentioned about vitamin C and the immune system.
Of course.
When you're in chemotherapy, the immune system is
Wiped
severely
out.
compromised.
Wiped out.
So
And
this helps you as far as keeping that up.
And one of the things I want to say is even immunotherapies, the new immunotherapies, they're pretty harsh on you. They're very harsh. So we have a protocol to help people through the immunotherapies. So, John, it isn't one size fits all in any arena in our facility.
As you've said, too, many times, sometimes the cure is worse than the disease.
Yeah. Look around.
Yeah.
Look around. That's true for lots of things.
Right.
People run around with their cardiac conditions and they think, oh, it's nothing. I'm on Plavix and Lipitor. And then you find out you're dead tired, right? You're dead tired. You can't go to work. You can't. I say, listen, how about if we can help you get off the Lipitor and maybe even help you reduce the Plavix safely? My doc gets in it safely. But believe believe it or not, there are natural anticoagulants out there.
And you've often said the least amount of pharmaceuticals necessary is your philosophy.
Exactly.
And this is why.
Right, because the side effects from this, cancer being the big one, that's the one that sort of shows the bright sign that says, oh, you're not going to do. No, there are many others, even more subtly, right? You got to watch.
Yeah, and as you've often said this, and we talked about, I was on Lipitor.
Yeah, bad.
All of those drugs.
Did you in?
Exactly, till they finally found something
right
that is working, but that's a common problem.
Exactly. And what we want to do is help you with that. And believe it or not, genetics play a little role in that.
All right, I know there's a bunch of cases you wanted to talk about today. Let's talk about a relatively new patient. He's a pilot.
Right,
and
Jeremy, yeah.
Back into this post-COVID again.
Yeah, he came to us for post-COVID, and I'm working with him, and he seems to be doing well, and I'm actually working with his wife as well. And here's the thing, though. He's an athlete as well. You can imagine he's a pilot. He's in great shape, right?
Yes.
So he had a problem with his knee. So Dr. Pat and I were in the office, and we said, we think we could help you with this without a surgical intervention. We think we could help you with progenitor cells. Well, he's a smart guy, so he went out to seek a second or a third opinion, which is okay with us. We like doing it. But by the way, on a side note, it took my Barbara forever to secure his report, his X-ray report, because the big monolith system really didn't want to release that because he had also seen their sports medicine guy who wanted to do the surgery.
They don't want to give up the patient.
No. So, but he also sought out a athletic specialist who believes in this kind of medicine, and he gave him one approach where he would take the progenitor cells from his bone marrow. However, I found it interesting. This morning I got an email from him outlining what the other physician would do. And on Thursday, he was telling Dr. Pat, well, they're using a camera and they're going to get it right into the torn. And when we started talking about this, I said, Pat, I'm not sure about this camera. Well, it turns out it's really a fluoroscope. They're looking, and it's sort of like the thing you use for when they go in and do the smaller surgeries,
yes,
the arthroscopic, that kind of thing. That's fine. But we thought, well, why do they want to do that with stem cells secured from the bone marrow, the progenitor cells from the bone marrow? This guy has a bone marrow or a bone disease already. Mild, but he has something in the spine. Why do we want to take his? Why wouldn't we want to use new, good progenitor cells? So that's something I want to discuss with him tomorrow when he's in, because Pat and I reviewed the data, and we have a few other questions about the taking the progenitor cells from the bone marrow.
All right, we're coming up on our final break of the morning, which means we still have time to take your call at 855-839-1210, 855-839-1210. This is the time to call because we got a couple minutes left of the show, so we still have time for one or two more questions. 855-839-1210. It's Health Watch, Sundays 8 till 9, Talk Radio 1210. WPHT. Dr. Molly Fantasia is here, the PhD doctor, the executive director, and the founder of Innovative Medical Associates, Marlton, New Jersey. With Dr. Molly, I'm John DeMasi. We return with more Health Watch after these words. And we're back here on Health Watch. Operator standing by right now at Innovative Medical Associates, 856-489-0505. You can call right now, or you can call after we leave you at 9 o'clock, and you can call later on today. I mean, they're there all day, 856-489-0505, Innovative Medical Associates, Marlton, New Jersey. And the website, a lot of good information on that, including previous radio shows. You could check out some things we've talked about before here on the show. You can check out the web, innovativemedicalassociates.com. InnovativeMedicalAssociates.com is the website. And don't forget, if you miss any of today's show this morning, you can check us out this afternoon, our Health Watch replay, 4 until 5 this afternoon here on Talk Radio 1210 WPHT. We're going to go to the phones right now. Back here on Health Watch, Mike is in Gloucester City. Mike, good morning. You're
morning,
on the show with Dr. Molly.
Good morning, Mike.
Good morning. How are you today?
Good. How are you doing?
Okay, I wanted to ask you something. I had I'm a Vietnam vet, and I got cancer apparently from all that stuff I sprayed in Vietnam. Back in 2011, I was diagnosed with rectal cancer. So I went to a hospital, Delaware County Memorial Hospital. I lived in Delaware County for most of my life.
Okay.
They gave me 42 cancer treatments with the radiation.
Yes, sir.
They were very long, 4 hours long.
Yep.
For 5.5 years, all I did was defecate.
Yeah, I believe it.
70, 80 times a day.
Terrible condition, Mike.
I mean, I'm still. Yeah, go ahead.
I want to say, listen. I know you've lived through Hades, my friend. I know that.
Right.
God bless you. God bless you. Go ahead.
Yeah, I just wanted to say, how long does this last?
It can last. It can last a
lifetime.
very long time. Yes, it can last a long time. I'll tell you, Mike. God bless you. You're in Gloucester City. You should come in and see me. You should. Listen. I don't think we can stop the effects from the radiation. But I think I could give you a little more energy and things like that. And in the meantime, I'm going to tell you, I'm praying for you because you're exactly the type of patient who've really suffered more, I think, from the symptomatology and the actual course of treatment than the cancer itself. But honest to God, Mike, how old are you, by the way? Just a side note.
I'm 71. I'll be 72 in June 15th.
You're a young guy. God bless you. And listen to me. You are.
Funny.
But listen to me. You're going to have a whole new group of prayers going up for you. Okay? God bless you. Mike.
I just want to ask you one more question.
Sure.
I was at the VA. They gave me Anyway, well, what I want to know is can I take pain medications after taking blood thinners?
Well, here's the thing. I think you need to make sure you speak to a really good pain doctor. And when you say you went to the VA, were they the folks who wanted to prescribe the pain meds or the blood thinners or whatever? Who's managing your care right now?
Well, see, they prescribe blood. See what happened is I have tremors.
Yeah.
So the VA, just one of the doctors, she prescribed like 3 medications in a row. She said, the side effect of this medication will help you stop shaking. Unfortunately, it gave me blood clots.
Oh, my God.
So they prescribed blood thinners, and I took them up until July of 2021 because I was falling all over the place.
I believe it.
And she's like, well, we never heard any such thing. And
you know what, Mike? I'm going to tell you something. You need a good guy to manage all the meds you're on, everything, and you need somebody to manage your case. You need to go back to the VA and get a case manager too. You hear me? This sounds like you got a lot. God bless you.
Mike,
you hear
thanks
me, my
for the
friend?
call and good luck
and
with
I
that.
mean it. Bye.
You think you could help him?
I think he needs. I think he needs to go back to the VA.
Okay.
And he needs to really get someone in there. The primary care doc should be managing him. I mean, this is
this
not,
is like over here, over there.
Right.
Yeah.
And here's the thing, John. This reminds me of what happens conventionally. You go to one, they're myopic. You go to number 2, I only deal with your lung. I only deal with your rectum. I only deal with your head. You know what? You need somebody to deal with all of it, and that's your primary care doc. He or she should be helping you manage all of this care. And if it's through the VA, we have an obligation to take care of these guys and gals through the VA hospital. I've treated my share of vets, as you know.
Yes, I know you have. Quickly, we got a couple minutes left of the show.
Yeah.
The significance of the Alliance for Natural Health,
yes,
which you are a member.
Yes,
Talk about that.
Please. There's a brand new proposed regulation that's going to get through the Senate, also eliminating 143 more natural substances. Please, everybody, I'm a member of this group. They look out. They're a watchdog group that helps people who believe in having medical choice. If you want to do a more holistic approach, if you want to use vitamins, minerals, that kind of thing, please look them up. Alliance for Natural Health. You'll see they have this listed on there that this is going down. It seems the president has already spoken to one of the members of Congress. I think it's Dick Durbin, and he's going to sponsor the bill. And we really got to look at this, folks, because they want to limit your ability to get your vitamins, your minerals, your amino acids. And I really believe that part of this has come about because of all the spa-like places that have opened up, and they're afraid that people aren't getting medical care and going to these kinds of places. But the bottom line is, it's people's choice. We're entitled to have medical choice, no matter what that is. And I'm a big proponent that we have to look at that, John.
Sounds like they're trying to eliminate the competition.
Well,
and
I don't know.
They view you maybe as a competitor.
Maybe, but I think that the bottom line is people have a right to choose which way they want to go. I mean, this is please look at the Alliance for Natural Health. I don't get paid for saying this. In fact, I pay for the show. But the bottom line is this: we know that we really can't have things restricted. This is America, right?
Absolutely. And that's a good note to end the show on.
That's great.
That's going to put the wraps on another edition of Health Watch. Don't forget, operators are standing by right now at Innovative Medical Associates. And when we leave you at 9, they don't leave. So they're there if you want to call, get more information, or make that appointment to sit down with Dr. Molly for the initial consultation, which is complimentary. Again, that number, 856-489-0505. 856-489-0505. And don't forget our Health Watch replay this afternoon, 4 to 5, here on Talk Radio 1210 WPHT. And the website, innovativemedicalassociates.com, innovativemedicalassociates.com. For Dr. Molly Fantasia and everyone at Innovative Medical Associates, the lovely Linda, Barbara, delightful Dee, fabulous Fran, Joanne, and our nurses, Jess and Lana, and our medical assistant, caring Kathy. I'm John DeMasi. Thanks for listening. Have yourself a great week and a healthy one. We'll do it all over again next Sunday, Health Watch, 8 till 9, here on Talk Radio 1210 WPHT. You take care.
This program is a paid commercial announcement and in no way represents the views of WPHT or its management.